Yes, the Rural Health Center, we work with below poverty line patients. That these are patients who, in US dollar terms, would be earning less than $1.50 a day. And this is a family income plan, so it comes to about, in Indian rupees, about 15,000 rupees a year. These are people who normally have very limited access to healthcare, very limited access to the governmental system which is supposed to take care of them. Clinic started in 1999 when I came back to Rishi School. I studied here and then went to the Air Force and came back. And since then we have grown slowly. We've built up a team over the last 10 years. We see on an average about 100 patients a day or about 15,000 patients in a year. And this number is growing. But since there are human limitations and we're all getting on, so we restrict the number of patients every day so that we can do justice to them and we also don't get too tired at the end of the day and make mistakes. Now, this is a paid service, it's not absolutely free. Patients pay a small sum for consultation and for their medicines. It's all highly subsidized. For example, a patient will pay 10 rupees or about a quarter, 25 cents to register first time around, and then they'll pay 3 to 4 cents. They'll pay 3 to 4 cents for a subsequent visit. Medicine costs typically for a month of medicines for, say, iron and B complex and calcium will be about 10 rupees, that's another quarter. Or for blood pressure patients, it will be about 15 to 20 rupees, about $half per month, which is affordable by them over a period of time. We still have to raise to the tune of about 500,000 rupees every year. You can convert that into dollars, about $100,000 a year to run this place. No, not $10,000 a year. Yeah, $10,000. Yeah, we raise about $10,000 a year to run this place, which comes from friends, well-wishers, my alumni from school, alumni from college. They all contribute to this. Apart from this, whenever we have any special needs, for example, we need to send somebody to hospital or we need to buy some equipment, just an appeal which goes out to, again, this group of people who have been helping us and they chip in some money or the other, or some well-wisher will just walk by and give us some money. We've had a number of times when we really wished that we had a piece of equipment. Somebody out of the blue has walked in and given us money and said this is for equipment. So we've been very fortunate. We've been really very fortunate that a lot of good things have happened to this place without us asking for it or without us, saying that we have to do something so much. It just happened. There's so many good people in the world who just come and help us to see the sort of work they're doing. And it's like here we have 12 of us here. It's one large family. We have 14 people to help us doing the medical work, and we've got 5-6 support staff, administrative people, a couple of sweepers, 3 doctors, and it's like one family. We all share our joys, our happiness, our sorrows together, right? And of course, we keep trying to ensure that they get the best deal possible, so that with the limited resources we have, we're able to pay them. Thank you. That's good enough.
Okay. Yeah. So we'd interviewed about 30 people over a span of a year, and I did it with 2 friends, and we found out that the prices of food had increased, and the people who we interviewed, they felt that they were eating the same amount because they'd buy, say, a little quantity. They'd buy less quantity of dal, but they'd mix more water with it to dilute it. So psychologically, they were fine because they thought they were eating more. They thought they were eating the same amount, but actually, the nutrition they were getting was much less, and they'd mix more water with their milk and things like that. So we related the amount of food they consume per person in a family to the nutritional value they're supposed to get, and we found out that it was much less than the actual amount that they needed to get, and so we did this to get to the grassroots level because there was a place which was in our school, and the staff worked with these people. So so we thought we might as well find out for ourselves and see the environment around us and see what effect.